For today. Before I begin my written statement, just to let you know, there are 3 new cases overnight, all in hotel quarantine. 2 have come from the UK, 1 from Macedonia. That brings our total number of cases since the beginning of COVID to 821. Around a month ago, Western Australia took one of the most significant steps on our COVID-19 journey. We moved from a hard border to a controlled interstate border based on the advice of the Chief Health Officer. The controlled interstate border is a uniquely Western Australian arrangement put in place to continue to keep our state safe and strong. And it has worked. It has worked. As of today, Western Australia has now gone 233 days without a single case of COVID-19 in our community. A remarkable achievement, thanks to the efforts of every Western Australian. Western Australia's border controls have been highly effective in reducing the number of potential cases of COVID coming into WA. From November 14, travellers from all states and territories that were deemed very low risk were permitted to enter WA if they complied with conditions. Travellers from low-risk states, that is Victoria and New South Wales, were also permitted to enter WA. However, additional strict measures were placed on these people, including a requirement to take a COVID test on arrival at Perth Airport if deemed necessary by a health clinician. The requirement to self-quarantine for 14 days in a suitable premise, and the requirement to present for a COVID-19 test on day 11 of their arrival in Western Australia. The controlled interstate border is a careful and cautious approach. It faced its first test only the day after it came into effect due to the concerning outbreak in South Australia. I always said we would not hesitate to reinstate the hard border if the health advice recommended it, and that's exactly what we did within hours in response to the situation in South Australia. When we announced the controlled interstate border, I also said the Chief Health Officer would closely monitor the situation in Victoria and New South Wales. Our main benchmark has been that they record no community cases for COVID-19 for 28 days. Victoria reached that milestone last Friday, and we hope New South Wales can reach that milestone this coming Friday. It has been a remarkable effort from Victoria in particular. Given the position they were in just a few months ago, it's an outstanding achievement, unrivalled around the world. As a result, our Chief Health Officer has assessed the situation further, taking into account testing regimes, border controls, and the recent outbreak in South Australia before providing updated health advice. Yesterday afternoon, the Chief Health Officer provided that advice to us, which has allowed us to make another safe and cautious decision. So I can now announce the following, based on updated public health advice and pending no further community outbreaks. Effective from 12:01 a.m, Tuesday, December 8, Victoria and New South Wales will be categorised as very low risk under our controlled borders. They will join the ACT, Queensland, Northern Territory and Tasmania as very low risk jurisdictions. Therefore, travel will be permitted to WA from these states with the following conditions. 1. All Perth Airport arrivals must undergo a health screening and temperature test on arrival. 2. Travellers must be prepared to take a COVID-19 test at the airport COVID clinic if deemed necessary by a health clinician. 3. Travellers must complete a G2G pass declaration stipulating they do not have any COVID-19 symptoms and which jurisdictions they have been in over the past 14 days. 4. Travellers must confirm they have not knowingly mixed with anyone from South Australia. And 5. Land arrivals will be met at the border checkpoint for a health screening and to have their G2G pass declaration checked. 14 days of self-quarantine will no longer be required from December 8, with Victoria and New South Wales falling into line with other Australian jurisdictions except for South Australia. I'd like to acknowledge and thank everyone for their patience and understanding, not only in recent weeks, but over the course of this pandemic. It's been a long wait. Our first border controls were introduced all the way back in March, 9 months ago. As a country, I'm so relieved we've gotten to this point. It's a credit to all Australians that we are nearly at the point of eliminating the virus in the community. The Chief Health Officer advised us that the updated controls for Victoria and New South Wales could come into effect on or after the 4th of December. Together with the Police Commissioner, the Chief Health Officer and the Health Minister, we decided to give everyone a few days before we implemented the changes. This allows for people to adjust travel arrangements if necessary, airlines to put on additional flights, Perth Airport to prepare for the changes, and our police force and health staff the time needed to implement the changes. We're also just being that extra bit cautious. We can take this next step safely and cautiously thanks to the recent success of our friends over East in getting the spread of the virus under control. I make the point again, we will not hesitate to reinstate the hard border if there are outbreaks over East and we get medical advice to do so. I know the past 8 months has not been easy. Past 9 months has not been easy. I know the border arrangements have put pressure on families and have at times been hard to comprehend. I never thought, as Premier of the state, I'd be bringing in state border controls. It definitely has been an extraordinary year. But I want to thank all West Australia. I want all West Australians to know that every decision we've made throughout the pandemic has been made to protect our community based on expert health advice. I have sympathy for those who've been impacted. I look forward to Western Australians being able to see friends and family from New South Wales and Victoria under our controlled border regime. My parents live in New South Wales, so personally for me, it's a relief knowing that my parents are now safer at their home, and hopefully I might be able to see them sometime in the future. Regarding South Australia, we are not yet at the point where we can relax the current border controls. Travel from South Australia remains prohibited unless travellers meet the strict exemption criteria we introduced on November 16. South Australia will remain in the medium risk category at least until December 11. A review into this arrangement will be undertaken next week. I also want to be clear that if people are thinking of driving from over East through South Australia, you'll be then treated as travelling from South Australia. Anyone who has been in South Australia in the previous 14 days will then not be permitted to enter WA unless they meet an exemption criteria. I also can provide an update on the 2 square metre rule. Effective from today, places of worship will be exempt from the 2 square metre rule and will be able to operate at a 60% capacity. This follows the same arrangements we have introduced for many other venues, including theatres and cinemas. I'm glad we can take this step and thank those people for their patience and understanding whilst we assess the situation before making this decision. Western Australia does remain susceptible to an outbreak, given nearly all physical distancing and gathering restrictions have been removed. And while the 2 square metre rule does act as an impediment to some sectors, it is in place to better protect the health of the community. So I want to take this opportunity to remind everyone to download the Safe WA app. Our mandatory contact register systems will come into force from this Saturday. So to help keep WA safe, download the Safe WA app.